Hello, and thank you for joining us for today's webinar in which we will be exploring drug interaction data reported by Aegis through findings of our InterACT Rx testing. My name is Dr. Savannah Clary, and I am a clinical pharmacist at Aegis Sciences Corporation. It is my pleasure to present today's webinar for you. Drug interactions heavily impact patient care, so this is a very important topic for clinicians in all specialties. To make sure that everyone can hear clearly, please make sure your microphone or phone line is muted during the presentation. There will be a time for questions at the end of the presentation. Our objectives for today are to provide an overview of InterACT Rx testing, recall possible limitations in current practices in identifying drug-drug and drug-food interactions, discuss Aegis findings regarding rate of interactions identified and substances most identified in interactions, describe examples of the potential clinical impact of drug-drug and drug-food interactions, and consider criteria that may help identify patient candidates for InterACT Rx testing. Drug interaction is a broad term used to describe the possible alterations, limitations, and enhancements to the clinical effects of a medication that may be caused by other drugs or substances, foods, supplements, or medical conditions. We will use the abbreviation DDI as an all-encompassing term to refer to these possibilities throughout the webinar today. The possible effects of DDIs can be extensive, both clinical and financial. Clinically, DDIs can lead to adverse drug events, or ADEs, reduced medication efficacy, reduced adherence to avoid the ADEs, and overutilization of medication to combat reduced efficacy that may be caused by DDIs. The clinical effects of DDIs can be anywhere from mild to moderate, life-threatening in some cases, or even fatal. Financially speaking, DDIs can lead to increased office visits, emergency department visits, hospitalizations, and additional medications to treat ADEs. Many studies have been done over the years looking at the financial impact of DDIs on the healthcare system. DDIs can lead to ADEs, and it is estimated that approximately 50% of ADEs are preventable. Appropriate monitoring for DDIs presents a great opportunity to avoid these clinical and financial outcomes and improve the quality of patient care. There are multiple mechanisms available for identifying DDIs, however, each have some limitations. Medication reconciliation may be performed using the patient's self-reported home medication list. However, these lists may be out of date or incomplete. Pharmacy-based drug utilization review can only encompass the data within that pharmacy software and excludes over-the-counter medications that patients may pick up, supplements they may pick up, foods, or medications they may be filling at other pharmacies that aren't connected to that pharmacy. The data from prescription drug monitoring programs can provide insight regarding controlled substances only, unfortunately, and automated DDI software can only analyze the data that's put into it, which may be incomplete. Alerts may also be overlooked, unfortunately, due to alert fatigue. Unfortunately, none of these tools listed here are infallible, so drug interactions may go undetected with use of these tools. From the previous list may be part of your current strategy for identifying drug-drug interactions. However, there is another tool available to help clinicians that is designed to reduce the risk of ADEs associated with DDIs through objective identification and reporting of interactions in urine and oral fluid. This testing tool is called InterACT Rx, and Aegis launched this tool in 2016 as a definitive testing tool for numerous substances that may contribute to DDIs with commonly prescribed pain management, behavioral health, and medication-assisted treatment drugs. So how does InterACT Rx work? Patients ingest medications, foods, over-the-counter medications, and/or supplements. And those recently ingested substances can be detected in their urine and saliva. One of those specimen types is collected from the patient and is sent to Aegis for medication adherence testing and InterACT Rx testing. Aegis scientists test the sample for all of the medications in the InterACT Rx testing profile. This includes commonly prescribed drugs from a variety of drug classes. I'll just list a few: antiarrhythmics, antiemetics, antidepressants, antithrombotics, chemotherapeutic agents, foods and supplements, steroids. There's quite a few that are available to be tested within the InterACT Rx profile. Any substances that are identified as present are checked against each other and against substances identified as present in the medication adherence testing to see if interactions exist. Interacting pairs are then reported to the clinician along with the interaction severity and a clinical description of the interaction. Let's take a closer look at how InterACT Rx results are reported. Below the medication compliance box on an Aegis report is the drug-drug interaction or DDI box if this testing is ordered. Substances that are identified as present and involved in a drug interaction are reported here. So first, the pair of interacting substances is listed, followed by the interaction severity, which ranges from significant, which is kind of a lower level of concern, all the way up to contraindicated, meaning these substances should never be used together. And then a clinical description of the interaction, which allows the clinician to see what the interaction can cause clinically and then make an informed prescribing decision as to how to resolve that interaction, whether it's changing something that they prescribe or reaching out to another prescriber to come to a decision that's best for the patient. The percentage of samples that have reported interactions from Aegis is really a testament to the clinical value of this testing. In samples for which InterACT Rx testing was ordered by a clinician between January 2021 and April 2022, at least one pair of interacting substances was found in 55% of samples. So that's just one interaction. As you can see on the picture that we looked at on the slide before, some samples have two or even more interactions than that. So it's a lot of valuable data that has been reported as a result of this test. There are many commonly prescribed medications in pain management, addiction recovery, behavioral health, primary care, and other clinical specialties that can contribute to clinically significant DDIs. Overall, the most identified substances involved in DDIs reported by Aegis are listed here. There have been over 10,000 occurrences of DDIs involving each of these substances. Buprenorphine has been the medication most often identified in DDIs through InterACT Rx testing. Buprenorphine is metabolized primarily by N-dealkylation via the cytochrome enzyme CYP3A4, as well as glucuronide conjugation. If CYP3A4 function is induced by another medication, this can lead to decreased plasma concentrations of buprenorphine and decreased efficacy, or onset of withdrawal syndrome. If CYP3A4 function is inhibited by another medication, this can lead to increased plasma concentrations of buprenorphine and increased or prolonged opioid effects. There are also pharmacodynamic interactions that are possible with buprenorphine, and these can cause additive CNS depression, which can lead to profound sedation, respiratory depression, coma, and/or death. The most identified buprenorphine-involved DDIs with over 100 occurrences of each of these interactions are listed here. This includes a variety of medications from pain management, behavioral health, and medication-assisted treatment. So quite a spectrum of interactions with buprenorphine that we have observed and reported. The second most identified drug involved in DDIs by InterACT Rx testing is oxycodone. Oxycodone is metabolized by CYP3A4 to noroxycodone and by CYP2D6 to oxymorphone. DDIs can affect oxycodone efficacy as well. Patients who express inadequate pain control may be incorrectly labeled as drug-seeking when actually a DDI may be reducing the efficacy of their medication. Identification of drug interactions with pain medications is important, not only for resolution of the interaction and improved medication safety and efficacy, but also to ensure that the prescribed dose of the pain medication continues to be appropriate. Careful monitoring, especially around medication changes to resolve DDIs, is important to ensure safe and appropriate dosing. The most commonly identified oxycodone-involved DDIs with over 100 occurrences of each of these interactions are listed here. I chose a couple to highlight with pictures as these are things that might not be as readily remembered as medication interactions. Alcohol increases the CNS depressant effects of oxycodone, and grapefruit inhibits the CYP3A4 metabolism. So these are also very important and very frequent interactions that we see with oxycodone. Another scenario that can occur is interactions with short-term medications, such as antimicrobials that are prescribed for acute illnesses. This is an example showing clarithromycin and inhibition of oxycodone metabolism via CYP3A4. Patients may visit urgent care centers and use alternate pharmacies for acute illnesses due to convenience or because due to the time of day, their regular provider or their regular pharmacy may not be open. These medications may not be able to be fully vetted for drug interactions since the acute care provider may not have access to the patient's full medical record, and the dispensing pharmacy may not be aware of all of the patient's medications. As with any type of laboratory testing, the decision to order InterACT Rx testing is at the clinical discretion of the ordering provider with consideration of the patient's medical history, their current presentation, and the complexity of their medication regimen. It is not a test that should be ordered for every patient necessarily or on every urine or oral fluid sample that is provided by a particular patient, and it's not intended as a screening tool, simply as a broader testing tool to see what all a patient has recently ingested. There are, however, many patient scenarios that may benefit from InterACT Rx testing, such as those who are experiencing polypharmacy, which is defined as taking 5 or more medications, patients who are experiencing intolerance to a prescribed therapy, patients who are not responding well or are stating their medication is not effective, those with dose escalation requirements for effective treatment, patients who are at risk of an incomplete medication profile due to a complex past medical history, patients who are at risk of morbidity from drug interactions, patients who are experiencing or reporting signs of an ADE, or patients who are recently hospitalized or went through another care transition. These are all opportunities for interactions to be evaluated to see if they are the causative issue for what a patient is experiencing, or if whatever event the patient has recently experienced, if that has caused a change in their medication list that has created an increased risk for an interaction. So these are all opportunities at the discretion of the provider to consider InterACT Rx testing. I hope you've enjoyed today's brief presentation on InterACT Rx. This testing tool has been shown in multiple studies, which we'd be happy to share with you to improve the rate of DDI detection, diagnosis, and treatment. And when utilized appropriately, objective results of InterACT Rx testing can help clinicians improve medication management and outcomes and reduce overall health system costs. At this time, you're welcome to unmute and ask a question if you have one. Alternatively, if you'd feel more comfortable, you're welcome to contact our clinical team offline at the phone or email on your screen, and we are happy to discuss InterACT Rx or any other toxicology questions that you may have. So if you all have any questions, please feel free to unmute and ask. All right, well, if no questions, we'll go ahead and adjourn for today, but I wanted to thank you again so much for joining today and have a great rest of your day. Bye-bye.